So we are going to continue. These are the types of the chronic wounds, and now we give a look to the therapy. First of all, believe it or not, there is no guideline that leads to the healing of chronic wounds. What it is, there is a lot of experimentation. Worldwide experts, they have a consensus, and today's consensus has a name, and the name is MOIST, M-O-I-S-T. I'm going to explain to you. The M stands for moisture balance, for exudate management. The moisture balance has been the gold standard for the treatment for chronic wounds for several decades. It is important to ensure that wounds are neither too wet nor too dry. For example, dry wounds can be moisturized with hydrogels, but usually, however, there is an excess of exudate so that wound products such as super absorbents are used. That was the M. The O stands for oxygen balance. Oxygen balance. In the pathophysiology of chronic wounds, hypoxia plays a decisive central role in almost all wound types. For sure, if there's not enough flow, there's not enough oxygen. If there is not enough oxygen, there's not enough energy for the cell's metabolism. The result is death. No flow. No flow means death. Wound dressings, hemoglobin spray, as well as normal and hyperbaric procedures are available for this. The market is very creative, believe it. And here, the IVT is becoming now more and more the gold standard. You can imagine the IVT with sucking, pushing, capillary dilation, compression. It brings in the fresh nutrients, the fresh blood, the fresh plasma, and above all, the oxygen. Oxygen, very important. Without oxygen, no life. The I of MOIST stands for infection control. The infection control describes all antimicrobial strategies, microbial strategies. Once there is a systemic antibiotic therapy, it is necessary if the if the wound is already infected. Then you need the antibiotic therapy. If the wound is not affected, there is a huge risk of infection, and therefore antiseptics or wound dressings are containing silver, for example, and they are used for infection prophylaxis as a prevention. Infection is a high risk of the chronic wound. The S of MOIST stands for support of the healing process. If the wounds do not heal despite apparently adequate therapy, specific wound therapeutic agents can be used temporarily that actively intervene in the disrupted wound healing process. What could this be? You can imagine, for sure, the IVT. IVT is coming again. Last but not least, in the MOIST, there is the tissue management. Tissue management describes all measures like neutral wound dressing, biosurgery like debridement, or physical therapy such as negative pressure therapy, we'll talk about it, electricity, electrotherapy, plasma, ultrasound. The target always is increased granulation and re-epithelialization. Regarding the VAC therapy, if you talk to somebody about the chronic wounds, they say, vacuum therapy if they are experts. And under the three words VAC, VAC assisted closure, they understand a negative pressure wound therapy. It's a technique that uses a suction pump, tubings, and a dressing to remove excess exudates. And that should promote healing as well. So it looks like there's the tube, there's a vacuum, there's the closure, and there's a pump, and there's the VAC pump or KCI or whatever. Believe it or not, it's done in nearly every hospital, but also for this one, for this, there's no first level gold standard study worldwide. It's done because there's no alternative before amputation, but there is no serious study. Now let's talk about the costs in the wound therapy. It's also important, I think. Then, because the treatment of chronic wounds is one of the highest cost centers of any national health system. No matter where you look this presentation, either in Malaysia, in Indonesia, in the United States of America, in Kazakhstan, in Russia, in China, everywhere in the world, the treatment of chronic wounds is one of the highest cost centers of your national health system. And this has reasons. The average costs are about 600 euro or 600 somewhat US dollar per patient per month, which is an average statistically 7,200 euro per patient per year. These costs are the result of the daily wound dressing changes. 2 times, 3 times changing the dressing per day. And that's not cheap stuff. Procter and Gamble and Coloplast and Johnson & Johnson. That's their major business, what we are talking about. And they keep that business for sure ongoing. There's nobody interested in healing of the chronic wounds, and that is why there is not sufficient healing. The patients are suffering for years and years and decades. And furthermore, you should know there is a high number of amputation despite the expensive wound management. We spend a lot of money, but because there is no healing, at the end, there is the amputation for so many. 5% of all chronic wounds are leading to amputation. In Germany, it's 60,000 patients per year getting the amputation. The incidence of diabetes-related amputations is 20 to 40 per 100,000. 100,000 people, adult people, 20 to 30 will suffer a diabetes-related amputation. And there's a high proportion of major amputations. Minor amputation, take off a toe. Major amputation, take off the whole foot or the lower limb in total. And these major amputations, they shorten the life expectancy. 50% of the patients who got that major amputation will die within the next 5 years. Summary. 1 to 2% of the population is affected on chronic wounds. That's a huge patient group. The patients are in pain, they are suffering. They have a complete loss of quality of life, zero. They are still living, but there's no quality in life. There is a wound management instead of therapy, a healing concept. At the wound management, they concentrates on dressing on behalf of Johnson & Johnson and Coloplast and all these companies, and it's extremely expensive. And despite the costly wound management, there is still a high number of amputation. Make a break.